Someone needs to explain how an RN at your company can second guess a neurologist who's been treating MS patients for the last 20 years. She's going to miss her infusion window, which could result in a relapse. This is Aaron. I'm a licensed clinical social worker. I'm calling on her behalf because the disease modifying therapy for her MS to Sabri was denied. The notice said it's not medically necessary. That's what the reviewer had put on there. It does not make sense. It's literally the same medication that she has been stable on. This is also a medication that you can't stop it suddenly. It's well documented that cause flares. It's saying continued authorizations based on evidence of benefit and absence of disease progression, which that's been demonstrated in her chart. All that stuff has been sent over. Results of her latest MRI was included and they are clear. Even the denial summary, it even says that. Now she has to wait for a peer-to-peer that may take 2 weeks to schedule. You realize that I get it. You're not personally making this decision. I'm not coming at you. I apologize if it feels that way. It looks like this denial is less about medicine and more about cost containment. She's been on this medication. If possible, we'd like to request an expedited review so you can get it in 72 hours if the provider calls it urgent. That's better than 2 weeks. I'll ask neurology to file that immediately. Can you also note on the record that the patient's currently stable, but at risk of relapse due to delay? I really appreciate you taking the time to hear me out on this. I know you've got metrics and scripts to follow. Send me the fax number for the urgent appeal line. I'll make sure that you get over everything that you need.